where oftentimes like your progress might be incremental over many days or weeks or months, years
Yeah.
in that time span. Acknowledging that, are there any like mantras that like you have for yourself or like considerations that you use to kind of, I guess, like reassure yourself or keep yourself going in the face of what you might see as like slow progress?
So I think it's important to not get bogged down that even a baby step with respect to progress is progress, but it's also important to take care of your own wellness because a lot of the cases that we do see, they're chronic in nature. As we know, dementia, there's no cure for it, right? So it's a lot of symptomatic treatment, and psychoeducation around that for ourselves is also helpful. So it's progressive. It is going to get worse. It's just a different kind of timeline on when that does happen, depending on what the etiology is. And so for that, it's important to take care of your own wellness when you're taking care of some of these patients, because you can see the cases are becoming more and more complex. Like even as I go through residency, the population in general is just becoming really sick. So being able to take care of yourself so that you can take care of your patients, I think is the most important. And I don't think that's specific to Geri Psych. I think that's same like across the board for anybody in any specialty, but more so for us when we see these chronic cases, it's hard for us because you can get bogged down by feeling that you're not improving anything, or you've tried so many different medications, so many different non-pharmacological strategies, you're trying your best, things still aren't getting better. And you may have to follow them potentially until the end of their life. So that within itself it's challenging to deal with, right? Because we go into medicine to help people get better, or a lot of us do,
Yeah.
right? And seeing sometimes it's hard to accept that there is no other side where people may get better, but helping their symptoms in the moment and providing that holistic approach or holistic treatment is also helpful.
And like the presence of you in that patient's life, and also like with other healthcare providers, knowing that they can rely on you in case they might not know how to manage certain behaviors or manage certain symptoms of like progressive diseases.
Yeah.
That in itself is a benefit as well,
Yeah.
for sure. Yeah.